Welcome back to my channel, and if you are visiting this space for the first time, you are also highly welcome. In this channel, we simplify anatomy, and here we also learn anatomy with so much fun. In this lecture, we'll be looking at the superior gluteal nerve. The superior gluteal nerve is one of the branches from the sacral plexus. I've also put up a lecture on the sacral plexus. If you've not checked up that lecture, please kindly go and do so to keep yourself updated. We say that the superior gluteal nerve is an emergence from the sacral plexus. The sacral plexus is a collection of nerves located within the pelvic cavity. If you try to use this image by the side here, this is where we have the collection of nerves coming together, and this is what is highlighted here in dotted yellow and also in dotted red. It is from this that we have the superior gluteal nerve, and this is what is highlighted here in black. So in this lecture, we'll be looking at the details on how the superior gluteal nerve emerges from the sacral plexus, the part that it runs from, where it emerges from, and also the number of branches that it gives along this course. The superior gluteal nerve, we say that it is an emergence from the sacral plexus, and we already highlighted in our previous slide that the sacral plexus is a collection of nerves that you see in the pelvic cavity. If you try to use this image by this lower side, we have a collection of nerves here that are highlighted in dotted yellow and also dotted red. This collection of nerves are specifically the ventral rami of these nerves that are seen to contribute to the formation of the sacral plexus. So you have the ventral rami from L4, L5, S1, S2, S3 and S4 spinal nerves. These nerves will come together to form the sacral plexus. And it is from this sacral plexus that you have a number of nerves emerging from. One of the nerves that you see emerging from the sacral plexus is the superior gluteal nerve. And this is what is highlighted here in black. This is what this lecture will be focusing on, and also driving deep into the details on how the superior gluteal nerve emerges. We say that this superior gluteal nerve, it is an emergence from the ventral rami of L4, L5, and S1 spinal nerves. Because we already stated previously that the sacral plexus itself is an emergence from the ventral rami from L4 to S4. But specifically, the superior gluteal nerve would emerge from the ventral rami of L4, L5, and S1 spinal nerve. The superior gluteal nerve is not the only emergence from the sacral plexus. We have other emergence from the sacral plexus, but because we're focusing on the superior gluteal nerve, and this is where we are driving deep into how this nerve emerges. So it is specifically an emergence from the ventral rami of L4, L5, and also S1 spinal nerves. But this ventral rami are also seen to further subdivide into divisions. So we have the ventral and the dorsal divisions. So the superior gluteal nerve is seen to emerge from the dorsal divisions of this highlighted rami. Let's drive deep more into how the superior gluteal nerve emerges, using this image by the side to illustrate this. The spinal nerves are seen to give rami. So we have the dorsal and the ventral rami. And also these spinal nerves are also seen to begin from the cervical region down to the coccygeal region. And each specific regions attack specific names based on the regions that they are located. For the lumbar spinal nerves are located in the lumbar region, while the sacral spinal nerves are located in the sacral region. These spinal nerves are further seen to subdivide into the dorsal rami, and this is what is harrowed here in purple, and also the ventral ramus, which is also harrowed here in yellow. This is what is seen along the vertebral column, and this is what is exhibited by each of the spinal nerves. So this is the presentation that you have that goes along the vertebral column. The ventral rami are also seen to further subdivide into divisions. So you have the ventral division, which is what is harrowed here in red, and also the dorsal division, which is also what is harrowed here in blue. So you see that the ventral ramus will further subdivide into the ventral division and also the dorsal division. So this is how the pattern of division occur along the spinal segments in relation to the spinal nerves. So if you drive deep to how the superior gluteal nerve emerges, we see that the superior gluteal nerve emerges from the ventral rami we already established that the ventral rami is what actually contributes to the formation of the sacral plexus. So we will be focusing on this ventral rami. This ventral rami from L4, L5, and S1. But more specifically, this ventral rami is also seen to further subdivide into the ventral division and also the dorsal division. So you see the ventral branch and also the dorsal branch, but specifically it is from the dorsal branches of the ventral rami from L4, L5, and S1 spinal nerves that the superior gluteal nerve emerges from. And this is what is heralded at this point. So we can say that the superior gluteal nerve is an emergence from the dorsal divisions, as you can see on this side, from the ventral rami of L4, L5, and also S1 sacral spinal nerves. And this is how these nerves will come together to form the superior gluteal nerve. So this is the details on how the superior gluteal nerve emerges from the sacral plexus. We already highlighted previously that superior gluteal nerve is not the only emergence from the sacral plexus. I said that I've put up a lecture on this. You can go and check up the number of nerves that emerge from the sacral plexus. But because we are focusing on just the superior gluteal nerves, so you say that the superior gluteal nerve is an emergence from the dorsal divisions, as you can see on this side, of the ventral rami, also as you can see on this image, of L4, L5, and S1 sacral spinal nerves. So you see how easy this is. And of course, this image here we've used to illustrate it in the most simplest way. We now know how the superior gluteal nerve emerges. We know that the superior gluteal nerve is an emergence from the dorsal divisions of the ventral rami of L4, L5, and also S1 sacral spinal nerves. This we have highlighted in our previous slide. So going further on the path that it runs, we know that this emergence occurs within the pelvic cavity. And if you look at the name of this nerve, it is the superior gluteal nerve. It is a nerve of the gluteal region, which means it needs to exit the pelvic cavity so as to be able to access the gluteal region. So you see that after its emergence from the pelvic cavity, it is seen to be directed superiorly above the piriformis. And this is how it runs within this region. If you look at this image by the side, this is where we have the piriformis here, heralded in yellow. We know that the piriformis emerges from the anterolateral surface of the sacrum, and the fibers are directed through the greater sciatic foramen. This is how this muscle exits the pelvic cavity. And you see that the fibers here are finally inserted on the greater truncator of the femur. So if you look at this orientation here, this is what is established of the piriformis. So you see the superior gluteal nerve parting above the piriformis, and this is what is highlighted here in blue. So after the emergence of the superior gluteal nerve from the sacral plexus, you see that this nerve is directed above the piriformis, and it is through this course that it exits the pelvic cavity. Remember, we said that this nerve needs to exit the pelvic cavity because it is a nerve of the gluteal region. So it needs to exit this space for it to be able to access the gluteal region. So within this space, you see that it is directed through the suprapiriform foramen. The suprapiriform foramen, if you try to break down the name, as I've always said on this channel, you see that the suprapiriform foramen is a foramen that is created above the piriformis, just as the name implies. So it means that a foramen is created superiorly here above the piriformis. And this is what is referred to as the suprapiriform foramen. Let's see more details about the suprapiriform foramen. If you try to use this lower image, this structure here is the posterior region of the pelvic cavity. And around this posterior space, we have an indentation that is created here that is highlighted in dotted red. This indentation is created on the ilium, and this indentation is referred to as the greater sciatic notch. If you go back to my lecture on the bone in pelvics, we already highlighted this structure in that lecture. So the greater sciatic notch is an indentation that is created on the ilium, and of course it is a notch because it is an indentation. So it is created around this superior region. This greater sciatic notch is what is transformed into the greater sciatic foramen. But this transformation is done by the sacrospinous ligament. So this is where we have the sacrospinous ligament here at this point. This sacrospinous ligament, also what we need to do is to also break down the name. Sacros, spinous. It means a ligament that runs from the sacrum to the spinous process of the ischium. So if you look at it, you see it running from the sacrum here. This is where we have the sacrum, and you see it running to the spine of the ischium. And this is what is seen on this other side. So you see this ligament running to and fro, these two sub-regions. And in this course, it is seen to be transforming this notch that is highlighted here in dotted red into a foramen. So you have the creation of the greater sciatic foramen around this space. And this is what is highlighted here in yellow. This greater sciatic foramen, of course, is now formed as a result of the sacrospinous ligament transforming the greater sciatic notch into this foramen. So this is the kind of presentation that you have on this side. So if you go back to the emergence of the piriformis is what is arrowed here in purple. Remember, we described this piriformis in our superior image here that is arrowed here in yellow. This piriformis has its fibers originating from the anterolateral surface of the sacrum. This is where we have the sacrum here. This is the posterior view. So you have the fibers of this muscle originating from the anterolateral surface of the sacrum. And you see that the fibers here are directed through the greater sciatic foramen. This greater sciatic foramen, remember, it is created by the sacrospinous ligament transforming the greater sciatic notch into it. So you have the fibers of the piriformis directed through the greater sciatic foramen. And this is how the fibers of this muscle will exit the pelvic cavity. And finally, they run laterally, where they will be finally inserted on the greater truncator of the femur. This is where we have the femur here on this side. So this is the kind of presentation that you have around the posterior region of the pelvic cavity. So if you look at the pattern by which the piriformis runs through the greater sciatic foramen, you see that it is helping to further subdivide this foramen into two foramina. So superiorly here, you have the suprapiriform foramen. This suprapiriform foramen, just as the name implies, is a foramen that is created above the piriformis, although still within the greater sciatic foramen. Then you have another foramen inferiorly here that is arrowed in green, which is the infrapiriform foramen. This infrapiriform foramen is a foramen that is located below the piriformis, and this is why it is infra, although still within the greater sciatic foramen. So you now see that the greater sciatic foramen is further subdivided into the suprapiriform foramen and the infrapiriform foramen. So you have these two foramina created as a result of how the fibers of the piriformis run within the greater sciatic foramen. So this is what is established here around this posterior region. So you see that specifically the superior gluteal nerve is seen to run above the piriformis here, as highlighted in this superior image. And this is what is highlighted here in blue. And because of this, if you go down to this inferior image, you also see that this is how it runs, of course, passing through the suprapiriform foramen. So you see that it passes above the piriformis, specifically through the suprapiriform foramen, which of course is a subdivision of the greater sciatic foramen. It does not pass through this alone. It is seen to run along with the superior gluteal artery and also the superior gluteal vein. And this is what you see here that is highlighted in red and also here in brown. So it does not run alone. You see it being accompanied by its corresponding name, artery, and also vein. So upon exiting the pelvic cavity, remember we highlighted previously that the superior gluteal nerve is the nerve of the gluteal region. So it needs to find its way to exit the pelvic cavity. And it has been able to do this, as we highlighted in our previous slide, through the suprapiriform foramen. So after exiting the pelvic cavity, this nerve is seen to run lateralward. So it is directed laterally. And you see it parting between the gluteus medius and also the gluteus minimus. We've also tried to highlight the gluteal muscles in our previous lecture, also on the gluteal region. If you've not watched that video, please kindly go and do so to also keep yourself updated. This is where we have the gluteus minimus here highlighted in red. We say that the gluteus minimus is the deepest muscle around the superficial gluteal space. And this is overlined by the gluteus medius that is highlighted here in green. I tried to use this other side of the image so as to keep the superior gluteal nerve exposed. So you have this gluteus medius highlighted in green lying upon the gluteus minimus. Then you have the gluteus maximus that is highlighted here in purple overlying on the gluteus medius. So this is how these muscles are in layers. If you look at the gluteus minimus here, that is highlighted here in red, you then have the gluteus medium lying on top of it. So in between these two muscles is where you have the superior gluteal nerve. And this is what is highlighted here in blue. If you try to put the gluteus medius on top of the gluteus minimus, you see that it will be lying in between these two muscles. And this is the part that it runs around the gluteal region. It is also seen to finally subdivide into the superior branch and also an inferior branch. This is where we have the superior branch here, highlighted in yellow. The superior branch, just as the name implies, is seen to be directed superiorly, and you see it running upward, while the inferior branch is what is highlighted here in white. The inferior branch is also seen to be directed inferiorly. The superior branch is seen to provide innervation for the gluteus medius. We know that this is the gluteus minimus here, highlighted in red, and this minimus is overlined by gluteus medius. So this superior branch is seen to be providing innervation for the gluteus medius that is highlighted here in green. Then you have the inferior branch that provides innervation for the gluteus minimus and also the tensor fasciae lata. This is where you have the tensor fasciae lata here highlighted in yellow. We said that the tensor fasciae lata is laterally located around the superficial gluteal space. So you see it positioned around this lateral edge, and this is what is highlighted here in yellow. So from the inferior branch of the superior gluteal nerve, you see two branches emerging. One of the branches will be providing innervation for the gluteus minimus, while the other branch will be innervating the tensor fasciae lata. So this is how this innervation is being distributed by different branches that emerge from the superior gluteal nerve. All in all, we have the superior gluteal nerve giving off a number of branches that are seen to innervate the gluteus medius, the gluteus minimus, and also the tensor fasciae lata. But specifically, it is the superior branch of the superior gluteal nerve that is seen to provide innervation for the gluteus medius, while the inferior branch is seen to supply the gluteus minimus and also the tensor fasciae lata. And this is what is represented here in this image. It is important for us to be able to highlight the specific branches that gives innervation to specific muscles. Then finally, we have the emergence of cutaneous branches. The cutaneous branches from the superior gluteal nerve are seen to provide cutaneous innervations for the skin around the gluteal region. So this is how the superior gluteal nerve gives off a number of branches, supplying different muscles, and also finally giving off cutaneous branches to supply the skin around the gluteal space. The superior gluteal nerve can be damaged, and this damage can occur as a result of intramuscular injection around the gluteal region, or when you have intense impact around this nerve. And when this damage occurs, of course, it will lead to the paralysis of the muscles that it innervates. Remember in our previous slide, we said that the superior gluteal nerve innervates the gluteus minimus, the gluteus medius, and also the tensor fasciae lata. And of course, the actions of this muscle will also be impaired as a result of this damage. We know that these muscles are known to provide stability of the pelvic cavity. The damage to the gluteal nerve can be diagnosed through the Trendelenburg test. This Trendelenburg test is used to assess the alignment of the gluteal region. So there is an alignment that should be created along the iliac crest. We have the iliac crest of the right pelvic girdle and also of the left pelvic girdle. There is an alignment that is supposed to be projected along this region. So let's say this is where we have the iliac crest here. The iliac crest on this side and also on the other side. If there is a deviation along the iliac crest, which means that there is going to be a displacement around this region. And this arrow here, of course, is signifying an inferior displacement of the iliac crest on the other side. And this is used to project the stability that is supposed to be created by the gluteus medius, the gluteus minimus, and also the tensor fasciae lata, which means that there could be possibly damage to the superior gluteal nerve. So this test can be used to detect damage to this nerve. So thanks for watching this video. Let's continue to stay glued to this channel.